If the patient comes to physiotherapy OPD with complaints of pain and restriction of motion, and on examination we find that when we flex the shoulder joint and adduct it, then the range of motion is reduced, as well as on passive springing, the joint feels painful, then the source can often be lying in the acromioclavicular joint. Now in this video, we are going to learn two important mobilization techniques that can help to quickly relieve the symptoms originating from a stiff AC joint. So let's get started. So to perform the mobilization, we are going to spring the distal end of the clavicle in relation to the acromion in the anterior to posterior direction, as well as from the cranial to caudate direction. Now please remember that it is interesting to note that to free up the AC joint, it is not the force of the mobilization which is important. In fact, it is the recoiling of the joint or the clavicle every time we take the clavicle into its direction of mobilization, which is going to free up the joint. So try using this method with less force and try to spring and recoil the joint backwards to its original position. So let's have a look. So to perform the mobilization for the acromioclavicular joint in the anterior to posterior direction, one hand of the therapist is going to stabilize the scapula from the under, and now the other hand, thenar eminence, is going to be placed over the distal end of the clavicle. And now from here, the therapist is going to take up all the slack and then is going to deliver the anterior to posterior mobilization, and is every time going to let go the force so that the clavicle can be made to spring and recoil backwards. And this can be done for around 30 seconds. After this, the second phase of mobilization will be done by keeping the elbow bent. And now one hand of the therapist is going to stabilize the elbow by cupping the elbow joint, whereas the other hand, thenar eminence, is again going to be placed over the distal end of the clavicle. And this time the clavicle is going to be pushed by the therapist from the cranial to caudate direction, and again every time letting the clavicle to recoil back to its original position. And this again can be performed for around 30 seconds. So this was all about the AC joint springing, recoiling mobilization technique. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.